Our mission is to help you learn the English language. We have created easy-to-follow, free educational materials for those seeking knowledge of English.
I need help picking out a lotion.
It would be my pleasure to help you. What do you need help with?
I picked up some poison oak while hiking, and I can't stop itching.
We have Techni, and it is available in lotion or cream.
Do you find that one works better than the other?
I have heard that the cream is longer lasting.
Is there anything I can take that will help with the itching?
If you take an antihistamine, that would help a lot.
Thank you for helping me figure out what to do with my poison oak.
It was a pleasure. Come back anytime.
Your English has really improved in the 2 months you've been here, too.
Do you have to work late at the computer company again tonight?
No, I'm going to leave the office early today. My annual medical checkup is this afternoon.
How much longer will Mr. Schmidt be up in the mountains?
He's on a week-long meditation retreat and won't be back until this weekend. What's wrong with you, young man?
I've got a headache and a cough.
I see. You've got a cold.
What should I do, doctor?
Take this medicine 3 times a day.
Yes.
Drink a lot of water and have a good rest. You'll be well soon.
Thank you.
Have you been registered yet, sir?
No, I haven't been registered.
Are you a medical or surgical case?
I'm a medical case.
Do you have your medical history sheet with you?
Yes, here you are.
Please fill in this admission card. Well, how long do you expect to stay in the hospital?
The doctor told me to stay about 1 month.
But there are no beds available now. 2 patients will be discharged this afternoon, so you'll have to wait until then.
Well, when they leave the hospital, give me a call and I'll come back.
Certainly. See you in the afternoon.
Oh, I think I broke my leg.
Here, sir. Sit down in this wheelchair.
Thanks.
The doctor will be with you in a moment. I just need to ask you a few questions.
All right.
Name, age and date of birth, please.
James Taylor, 23, March 30th, 1982.
Health insurance company and policy no?
I don't have it.
What?
I don't have health insurance.
Well, this is going to be a very expensive broken leg, Mr. Taylor.
Oh.
Hello, sir. How can I help you?
Yes, I need this prescription, please.
Let's see. Okay, so 50 milligrams of Prozac. Would you prefer this in capsule or tablet?
Capsules are fine.
Okay, you should take 1 capsule 3 times a day. Be sure not to take it on an empty stomach, and also, don't ever mix it with alcohol.
Yes, I know. It's not the first time I'm taking this. Don't worry, I won't overdose.
Okay, anything else I can get you?
Oh, yes, I almost forgot. Can I also get some eye drops and some condoms?
Sure. Darn condoms aren't registered in our system.
Oh, well that's okay. I'll get some later. Thanks, really, it's no problem.
Just hang on there a sec. Can I get a price check on Fun Times ribbed condoms, please?
Excuse me, I want to pay the bill.
Please wait till your name is called.
Okay, your bill includes the doctor's fee and the cost for a 3-day supply of medicine. It comes to 100 yuan.
Here you are.
Good. Here is the receipt. The dispensary is over there, by the way. Will this be covered by your insurance from work?
No, I'll be paying for myself, but I have private medical insurance.
In that case, I'll give you a certificate, so you can get it reimbursed.
Thanks a lot.
Don't lose this receipt, because insurance companies are very difficult about helping when they don't have the right paperwork.
Come in and sit down, Jack. Now, what's the trouble?
I've got a terrible pain in my stomach, doctor.
I see. When did it start?
It started yesterday. I didn't eat any supper.
Have you got a temperature?
I think so. I feel very hot.
Let's see. Yes. You've got quite a high temperature.
I've got an awful headache, too, and my throat hurts.
I think you've got the flu.
Is it serious?
No, not at all, but you must stay in bed for 3 days and take this medicine.
How often must I take it?
3 times a day after meals.
Thank you, doctor. Goodbye. I have a terrible toothache.
Which tooth is it?
Pointing. This one here.
Ah, yes. There's big cavity.
Can you fill it?
I'm afraid not. The tooth is too far gone. It'll have to be taken out.
Then I might as well have it out now.
You'd better wait. The gums are swollen. Take the medicine I prescribe and come back in 3 days.
I have been getting headaches almost every day lately.
Have you just started getting a lot of headaches?
I never had very many headaches before, but the last few weeks I have been getting a lot of them.
Have you had any unusually stressful situations in your life lately?
My mother just passed away last Tuesday.
I'm sorry. How about sleep? Are you getting enough rest?
I have been working really hard, and sleep has not been a priority.
Have you bumped your head or fallen lately?
No, I haven't hit my head.
I am going to send you to a neurologist for a few tests.
Ah, it hurts. Don't touch it.
What part hurts?
The shoulder.
Well, maybe you broke it. But what I'm worried about is this cut.
It's not a cut. It's a gash. It's bigger than a cut. Ah, I need a doctor.
Come on. Just don't move.
I'm bleeding too much.
We don't have a decent first aid kit, do we?
Yes. My bike has one under the seat. Get it, quick.
There's some tape, iodine, and cloth bandages. I don't think the cloth bandages can stop the bleeding. What we need is a tourniquet.
Wrap a few loops of the bandages around my upper arm, then twist. That will work as a tourniquet. After that, you can cut more of the bandages to cover the wound.
Good plan. Let me put some iodine on the cut.
No, forget that. Do the tourniquet first. I'm losing too much blood.
All right. How did you cut this so bad?
Hey, you look great. How's everything?
Yeah, you know what? I've been going to the club regularly. The training really pays off. Now I am in a good shape and I know more about how to keep fit.
Really? Tell me about it. I haven't gone to the club for a long time. I am too busy with work.
It's important to do proper exercises.
You're right. Too much or too little won't do any good.
The trainer tells me, besides regular sports activities, I should also have a healthy and balanced diet.
Sounds reasonable.
We should eat more vegetables instead of junk food to stay energetic.
And fruits.
Surely it is. Getting enough sleep is also crucial for fitness.
I've heard that. Does your trainer tell you anything about keeping fit?
Yeah, he advises me to stay in a good mood. That can help one to keep sound physical health.
I think if you follow your trainer's advice, you'll be on the right track.
You bet it.
Doctor, I have the worst toothache.
How long have you had this pain?
For about a week or so, but it's gotten really bad in the last couple of days.
Did you do anything that might have aggravated your tooth?
You know, I was eating Jawbreakers in the movies the other day, and I accidentally bit down really hard on one.
What kind of toothbrush do you use?
I just use a regular hard bristle toothbrush.
Does it bother you when you eat something really cold?
Yes, it definitely bothers me more when I do that. I often sneeze after having a bad itch inside my nose. Sometimes this is accompanied by an itching throat.
Any other discomfort?
Yes. Sometimes I can notice a constriction in the chest and shortness of breath after a fit of sneezing. And I often suffer from a running nose with a profuse watery discharge.
Does it occur seasonally or all year round?
It has been seasonal during these past 3 years.
Are you sensitive to other things?
Yes, things like seafood and penicillin-type drugs.
Okay, let me examine your nose. According to your case history and the examination, I believe that it's allergic rhinitis.
What useful treatment can you offer?
I'll give you a series of specific skin tests. Then we'll know exactly what substances you're allergic to. Then I'll give you some causes of desensitization therapy.
I am dropping off my prescription to get it filled.
You can come back in 20 minutes, and it will be ready.
If I couldn't wait, could the prescription be mailed to me?
Yes, you can have it delivered or filled at any location in our HMO.
When should I take this medication?
You need to take it at bedtime.
Should I take this medicine on an empty stomach?
Don't mix alcohol with this medication, but you can take it with or without food.
What are the side effects of this medication?
You might feel a little dizzy at first, but it should pass.
What's wrong with you?
I have a sore throat and headache.
Do you feel tired?
Yes, my whole body feels weak. And I really feel terrible.
I'm sorry to hear that. I'll have to examine you.
Okay, go ahead.
Open your mouth and show me your tongue. Say, "Ah, you have a bad cold. So you must stay in bed for a week." Good morning. I would like to make a doctor's appointment.
Can you describe your health concern?
I have been having skin problems that aren't going away.
Are you in pain?
No, except for the rash, I feel fine.
Would Tuesday or Wednesday be best for you?
I would like to come in on Tuesday.
I will write you in for that day at 4.
I would like to see Dr. Smith.
I will write you in on that doctor's schedule. See you then.
You don't look so good.
I feel horrible. I think I picked up a bug.
Do you know who you got it from?
A lot of people in my dorm are sick. Perhaps I picked it up there.
Did you take any cold medication?
I've been taking vitamin C and zinc and trying to get some rest.
I think that rest and liquids are what doctors recommend for a cold.
My grandmother swears by hot chicken soup for a cold.
A pharmacist might be able to help you if your home remedies don't work.
Yes, if I get worse, I will definitely look for extra help with this.
I have a sore throat and my chest hurts.
How long have you been like this?
2 or 3 days now.
I think you've got the flu. There's a lot of it going around.
What do you think I ought to do?
Get this prescription filled and go straight to bed.
Good morning. What seems to be the problem?
Good morning, doctor. I feel terrible. I've got a cold and I have a rash here on my neck. I'm not sleeping well either. What do you think the problem could be?
I'd say you've been working too hard or are under stress for some reason. Have you been taking anything for your cold?
Yes, I bought some medicine at the chemist's. I've been taking it for 3 days.
Good. I'm going to prescribe something stronger. It will make you feel drowsy, so you certainly should rest.
Okay, I can afford to take a few days off work.
Have you been working hard recently?
Yes, I have. I had to get a project finished. It's done now, so I can relax a little.
Good. Let's take a look at that rash. It looks worse than it is. I'm going to prescribe some ointment for it. If the rash doesn't clear up in a few days, come back and see me. Do you have any other symptoms?
I have a bad headache, but...
Don't worry about that. It's probably of the stress you've been under. Just take some aspirin. Combined with the stronger cough medicine, it will make you feel very tired. You shouldn't work or use any equipment which requires concentration. If I were you, I'd just sleep, read a book, or watch TV. Here is your prescription.
Thanks, doctor. I'll get these immediately. Goodbye.
Following our free educational materials, you learn English in a great way with ease and efficiency.